Live.
Hi there, I'm Dr. Marty Nalda, and I'm here with a registered nurse practitioner, Miss Pat Seemann, who we're going to talk today about a series of videos that we're going to put together for you so that we could get the country open and running. The stuff you don't see in the media, there's a lot of fear mongering going on, and a lot of people are also very upset because their livelihoods are basically being shot with this. And so we are starting the Mask On, Move On movement because we're going to talk to you about some of the basic precautions that you could take to stay safe and get your life going again. All right? So I think the first thing we're going to talk about is we're going to ask Miss Pat here about the difference between droplet precautions and why the mask works, even the regular fabric mask like I have on. All right.
Okay. My background is 35 years. I am an advanced registered nurse practitioner, board certified family nurse practitioner. I also have rounded infectious disease at the hospital, and I ran an infectious disease clinic in Orlando. First, we're going to talk about Florida. 21.48 million residents, and as of today, we have 591 deaths by coronavirus. A total of 3,099 patients since January 19th until today have been hospitalized. Not all at once. We're talking a span of 4 months with 21.48 million residents in the state of Florida and 591 deaths. Okay? We're going to get into why that happens. However, because we are not a fake news source, Florida Department of Health, Google it. Go on their website, and you too, every day, like I have since January 19th, can get this beautiful summary report, and you can verify everything we are telling you today.
The other thing that we want to talk about is a lot of people, we've been driving around, and one of the scariest things that I see, and there's a lot of fear with this virus. And the fear, it's almost like paralyzing fear. People don't know when they should wear their mask, when they should not wear their mask. We were told first that the N95 mask is the only thing that works, and then we were told that we have to wear a face covering of some kind. Mm-hmm. And so what's the difference between, like, I've seen people literally walking outside to their mailbox, full garb in gloves and masks, and like it's raining from the sky.
Okay, this is not an airborne virus. Okay, the last airborne virus that I can remember was the measles, right? This is droplet precautions, meaning when you walk outside, it's not waiting for you. It's not going to chase you to your mailbox. You need to assume everybody you come in contact with is positive, and you have to assume you are positive. The reason we are not 6 feet apart is because we are following, like every healthcare professional, droplet precautions. My droplets can't get into her mouth if we both are wearing masks, even if we are not 6 feet apart. Now we are going to do hand washing. If I were to cough or sneeze, I'm going to turn away from her, and I'm going to cough into my shoulder. This virus loves 40 degrees. My brother is a brilliant engineer. He's done a ton of research, and he is right now publishing a paper. It does not like Florida weather. If we all follow the mask on, move on, we can open everything back up with modifications.
Okay, so one of the things that we talk about with modifications is, I know, one of the things that everybody's talking about is, especially the ladies, the hair,
yes,
the nails, all of these things. There's a lot of kids that are struggling. I mean, you think about the fact that there's a lot of parents that are still working from home, and that's a huge blessing right now because so many people are out of a job.
Right.
So they're working from home, but let's say you have 3 kids and you're working from home full time, and now you have a full schoolwork thing that you got to do with them, because if you have older children like I do that are college age just about, they could do their own stuff. But if you come home, or if you're home all day and now you have an 8-year-old, a 10-year-old, and a 12-year-old that you have to do schoolwork with, it's overwhelming. It's overwhelming. So a lot of the people are saying, well, we need to reach herd immunity. And how do we do that?
Okay, everybody. Herd immunity. Okay?
What is herd immunity?
Herd immunity is achieved in a couple different ways, okay? First, you have to have greater than 50% exposed, infected, and recovered in any population. Hiding in your house for months on end is not going to stop the viral transmission of COVID-19 or any virus. You're just prolonging the agony and you're destroying our economy. Okay, this virus is actually great. We know all about this virus. It targets 65 and older. In 2009, H1N1 would kill healthy children. It didn't matter. This one is specific. Over 65, immunocompromised, health problems. There have been no reported deaths under the age of 24 I don't think anywhere, that were healthy. Now, somebody's always going to pull up some fake news or twisted news. Okay, oh, a 7-week-old died. Okay, I talked to the admin of that hospital, actually. It was born at 22 weeks gestation. It was already on life support. While tragic, yes, the baby died and was COVID positive.
Every death is tragic, but the other thing that we're looking at is, right now, with the way the current situation stands, anybody that tests positive at the time of death is being attributed to the COVID-19.
Even if you just crashed your car into a wall.
And this is valid, guys. This is not us making this up. If you look at the way that the CDC is asking the doctors to report this, this is how they're asking to report. So these numbers are very inflated. Also, put aside the fact that most people that are going to contract this are never going to go to the doctor because the symptoms are so mild.
Right. So we want, in herd immunity, remember, we need 50% exposed, infected, recovered, immune. So when the media is screaming about, we need more COVID-19 testing, we need serology testing, which is being done at Orange County Convention Center. We want to know, has Florida reached herd immunity? Why is California, with 40 million people, have, at last count, less than 800 people dead from this? And I think about 3,000 or 4,000 hospitalized in the entire state. Could we have already reached herd immunity? Were we exposed early? We are big Disneyland, Disney World. We are huge tourism. I know so many people that are like, yeah, in January I had the worst case of bronchitis in my life. I didn't have the flu. Doctor put me on a Z-Pack. I got better. I was miserable, but I got better. That's herd immunity. This inner circle is our high-risk population. This is the population that's going to be on ventilators. This is the population that's going to be in the ICU. We have to protect the weak part of our herd. Now, we do this by opening everything back up with modifications. Masks on, move on. It's not perfect. It will not prevent every transmission, but it will build herd immunity in the 80%, especially the school-age kids, high school kids. Yes, if you live with grandma, you're going to have to follow droplet precautions. You learned how to drive a car, you can learn what droplet precautions are, right?
They're not that difficult.
Not hard.
So let's talk a little bit about droplet precautions now that we've gotten them going.
Yeah.
Let's say that you are that, teenager and you've been at school all day and you've had your mask on and you walk into your house. What should you do first?
Take your shoes off outside, come inside, wash your hands. Take your mask off, put it in a brown paper bag like instructed. I think everybody should make cute cloth masks, and you can wash them in hot water.
And that's kind of like what I have on, and I just wash them at night.
And you wash them at night. At the high school graduation, nobody over 65, you cart them at the door. But positive peer pressure. If these high schoolers really want to have their high school graduation, they're not the problem.
No, they are not.
They don't even need a mask. They're not the problem. It's when they go home to grandma. But for me, I don't have anybody that is high risk that I come in contact with except my patients. And of course, when I see a patient, I'm in full droplet precautions like I've always been. Okay, the fact that I've done this 35 years and have never been sick, and we're talking MRSA, flesh-eating bacteria, H1N1.
You mean you've always washed your hands?
I've always washed my hands.
Imagine that concept.
And I put a mask on when I was following droplet precautions.
The other thing we're talking about, we talked about hair, everything else.
Yeah.
How unsafe would it be if you went right now to a hairstylist and they had a mask like you have on and I had a mask like I have on, or even let's say the client can't put on a mask because you're getting your hair colored. How unsafe would that be if there was a limited amount of people at a salon and the stations were
6
feet apart?
Well, if everybody had masks on, they don't need to be 6 feet apart. But you're right. How are you gonna?
Yeah, you
Right.
can't. Okay, so let's say that the stylist has a mask on. How unsafe is that?
It's not unsafe at all if you are young, healthy, not immunocompromised. Okay.
Okay.
Again, we want the healthy herd to get exposed.
Well, that's how you build herd immunity.
That's how you build herd immunity.
Yeah.
Stay home, save lives was not stay home and then the virus is going to disappear.
Because the biggest fear that I personally have about this is, let's say they let us all out of captivity in May.
Right.
The virus is still there. It's not going to disappear. Just like
Right.
no virus in the history of all viruses have disappeared.
Right.
We've just become immune.
Right. Through herd immunity.
Correct.
Okay. Okay. Either you find a cure, which
It's a virus.
hydroxyquinone and zithromycin more and more studies are coming out. And Donald Trump was right. It now is the mainstay, the drug of choice. Okay. The other is to develop a vaccine that is effective in achieving herd immunity. That means the vaccine is greater than 50%. Ideally we would love 80%, but let's be realistic. And the other way is get exposed, infected, and immune.
And that seems to be the fastest way that
That's
we're ever going to
the
accomplish
fastest
this
way.
right
I mean,
now.
we have learned a lot. Advent Health, I know, I got a copy of the research paper, and we do know that putting people on vents was not the best idea.
No, and that's why so many people were dying across the world.
80%.
Yep.
It's high flow oxygen and every 12-hour prone positioning. Okay, so we as the medical community, we for weeks have been prescribing zithromycin and Plaquenil.
Okay, so now the whole fear about us running out of respirators is invalid. There's no use for them.
But the media keeps hammering on ventilator. No, only the 2 to 5% are gonna. They would have ended up on a ventilator from any flu, any cold virus, any bladder infection. They are the weakest of the herd.
Because as far as I know, the whole reason for flattening the curve was so that we would not overwhelm our hospital system with people that needed ventilators.
Correct. Stay home, save lives. You saved the life because you didn't overwhelm the hospital and they ran out of ventilators. It wasn't stay home and the virus is going to go away.
And
that's what people think.
And that's what people think.
I read on Facebook, we just have to hunker down till it's safe.
It's never going to be safe.
Until we reach herd immunity. It's never going to be safe.
And honestly, it's never going to be safe from anything because we live in an environment. I mean, I think the bacteria and viruses in our body outnumber our healthy cells like 10 to 1 or something like that on any day.
Right. Wash your hands.
Wash your hands, take some vitamins, get in the sunlight, eat healthy. Don't become a statistic. Most of the health factors for this right now are immunocompromised, if you are obese, if you have diabetes, and if you're on blood pressure medication. Guys, 3 of those things are things that you have complete and total control over.
And if you're diabetic, you're right. I did read the study where, because they have a higher glycosylated hemoglobin, this virus likes to go after the hemoglobin.
Yep.
So control your diabetes. I'm watching California very closely. My niece has been a type 1 diabetic for 35 years. It was the year I graduated from nursing school. I am a nationally certified diabetic educator and have devoted much of my career to diabetes education because of my niece Heather. And I'm very passionate about mask on, move on. I mean, and everybody's like, oh, I don't want to get this. Well, if you're my age or your age and you're healthy, you're going to get a bad cold. What do you hate worse, coughing or bankruptcy? Which one do you hate worse?
At this
Which
point,
one do you hate worse?
at this point,
I'll take the cough.
I'll take the cough. I'll
And
take the cough.
we don't know how many people are immune.
To be completely honest, as far as I know, it already went like fire through my practice in January and through my household.
I wrote more zithromycin and
Mhm.
had more chest x-rays sent out to my elderly patients than I can count. And in my aesthetics practice, they're telling me, don't you remember I had a cancel because I was coughing
how
my
many
brains
people have you
out?
had like that? Exactly.
So I think because the numbers are so low, I mean, you have Detroit, Michigan, 160 people are dying a day. They're inundated. New York. Why, with 21.48 million, are we still only at 591?
and we were like one of the last states to close down.
Right.
So
Because I think you're right. We had this December, January, and I think California did too.
and so, anyways, guys,
Serology test
serology testing would be the ideal thing.
to find out how many people have had it, recovered, and are immune.
Regardless, what you do not need to do right now is you do not need to wear the mask in your car.
No, please don't.
You do not need gloves unless you are changing them every time you touch something.
Correct.
Because I see people at the grocery store and they're touching every single thing. I believe the gloves actually transfer stuff worse than hands would.
Well, because guess what this virus loves? It loves metal and plastic and 40 degrees.
So again, wash your hands before you leave your house. If you have
No rinse hand soap.
no rinse
I
hand
have
soap.
it in my pocket.
If you could not find no risk hand soap, get a washcloth with soap and water. Keep it in a Ziploc bag. Put
Yes.
it in your car. Wipe your hands before you leave your car, before you go into the store. When you get back into your car, do it again. This thing
Right.
dissolves in
Yes.
soap.
Yes. You don't need to be hoarding this for you. A hand wash is more effective.
A hand wash is more effective. So if you don't have hand sanitizer, guys, wash your hands.
Right. Mask on, move on.
All right, guys.
All right.
So
if
this
you
is-
want to know how to make a mask, go to the cdc.gov. It has a little sewing machine icon. Click on it. It will give you all the instructions. Stop listening to the media. Stop going to random sites, cdc.gov, or your state health department. Get the facts. And we are going to mask on.